All right, great. So good morning again, and thank you for joining us for BHSB's legislative preview. As I mentioned, I'm Adrienne Bridenstine. I'm the Vice President of Policy and Communications at BHSB. A couple of housekeeping things before we move into the program. As I mentioned, the meeting's being recorded and we will send this out along with the slide deck after the legislative preview for those who have registered. We do have a packed agenda today with speakers, so we're going to be managing questions pretty tightly, and I request that if you have questions, put them into the chat. We may not get through all of the questions in today's forum, but we will track them and try to provide answers to all of them that we can afterwards and send those out as well. So very quickly, for those of you who don't know who BHSB is, we are a nonprofit that serves as the local behavioral health authority for Baltimore City. And we do a range of different things to support that public behavioral health system. But one of the big things that we do and are very active in this time of year is our advocacy work. We look at monitoring and influence and change at the state level, largely because our system of care, as you all know, is a state-driven system. And for those of you who can keep yourself on mute, that would help us as well. Thank you.
Thank you.
What we've come together today is to share with you our policy goals, which we will go over very quickly. Our policy goals are what we work on proactively during the legislative session and throughout the course of the year to help advance the system of care. But then we are also going to spend a little bit of time on, or a lot of time really, on what's coming ahead in terms of the state budgeting process and what we can look towards for the state budgeting for behavioral health services. So with that, without further ado, I'm going to introduce our speakers for this morning. And really quickly, here's our agenda. For our speakers, we've got Stacy Jefferson, who's our Director of Policy and Stakeholder Engagement at BHSB, and Dan Rabbit, our Policy Director. They will provide an overview of BHSB's legislative and policy priorities, and then we're going to move into a presentation about all things budget in Maryland. And we've got Christopher Meyer, who's a research analyst from the Maryland Center for Economic Policy, and Samantha Tapia, the budget policy analyst from the Department of Legislative Services. Those are our speakers. That's our program for today. Without further ado, I'm going to turn it over to Stacy, who's going to go over our 2023 legislative priorities. Stacy, take it away.
Good morning, everyone. Again, I'm Stacy Jefferson, the Director of Policy and Stakeholder Engagement with Behavioral Health System Baltimore. And we'll briefly go over our policy priorities. One thing I want to note is that our priorities are listed on our website. If you go into the page, and it's on our advocacy page, so you can find our priorities there along with other information related to session. Our policy priorities are 2-year priorities. So many of you, if you joined us last year, you are familiar with these priorities. I'll briefly go over them as they are, but then for each one, briefly talk about some updates on bills and things that we know that will come up this year during session. And so our first priority is to build a stable behavioral health workforce. This continues to be a concern. We know, many of you on the call know, particularly for behavioral health workforce, and as well as our healthcare workforce. This has been exacerbated by COVID, but definitely has been a problem before then. At the end of this, before Dan gets into information about the Fund 988 campaign, he can brief you on legislation that we expect that will come, that will address the behavioral health workforce. Also strengthening crisis services, as you know, with the GBRICS project, also with 988, there has been a lot of focus on continue to provide resources to strengthen our crisis services throughout the state of Maryland. This also is something that Dan will get more into. He'll talk about the Fund 988 campaign and other policy initiatives that we can expect this session for crisis services. So investing in co-design services for youth. And so this is again a policy priority that we've been working on over the past couple of years. Initially in past session, we were able to introduce budget language that will require a joint commission report that would look into co-designed mental health support services for youth and families in Maryland and around the country, and how Maryland can actually implement these types of programs and services um, for mental health. And so the JCR report was released. That report recommends that we continue to look into a co-designed model, but to put together a exploratory committee to really determine what Maryland needs in order to provide co-designed support services. And so what we'll be looking to do, along with our partners, particularly the Children's Behavioral Health Coalition, this session is to look at legislation that would put together this committee or work group that would start to work on looking at how do we implement these programs and services throughout Maryland. Next, priority, harm reduction continues to be a big priority for us. In addition to what's listed here, establishing overdose prevention sites, we also will be supporting other harm reduction legislation that will include the decriminalization of paraphernalia. We also may see a bill that will expand the protections for Good Sam, the Good Samaritan law as well. And we do know that the overdose prevention site bill will also be reintroduced again this year. And so with overdose prevention sites, we have continued to gain momentum. There is increased support in the city for overdose prevention sites, but also across the state. And so, again, we do expect that bill to be reintroduced this year, and expect us to move forward. And so I see that Adrian has also posted our policy priorities in the link to the policy priorities in the chat. Again, I know that was really brief, but we do have a little bit of time today to kind of go through this, and really want to spend time focusing on the budget, particularly with the new way in which the budget process will work this year. And so, as always, people can reach out to me if you have any questions about particular legislation or our priorities. In addition to that, we also do produce a newsletter that we do send out at least 3 times during session to kind of update you on where we are and what things to look out for as far as the legislative session. So again, I assume many of you, since you received the invite to this meeting, are probably on our email list. But if not, please be sure to sign up for our emails so that you can get those emails and kind of stay up to date with us. And again, we do post that information as well as the policy priorities on our advocacy webpage. So I'll turn it over to Dan so he can talk a little bit more about the workforce as well as Fund 988 campaign.
Thanks, Stacey, and good morning, everyone. Again, my name is Dan Rabbit. I rounded up the policy team with Stacey and Adrian here at BHSB. Like Stacey mentioned, before I jump into Fund Maryland 988 campaign, I did just want to touch on what we expect in the workforce area, as that's one of our policy priorities. We are working in alignment with our partners at the Behavioral Health Coalition on their Equal Treatment Maryland campaign. And workforce is one of their 3 pillars of that campaign. And so a bill to create a workforce investment fund that would have some flexible dollars that could be used to support all manner of behavioral health workforce issues, both pipeline as well as salaries, hiring, incentives, loan repayment, kind of the idea is to keep it flexible so that the fund can use whatever strategy they think is most helpful to promote strong and ample behavioral health workforce. But so that's really where we see behavioral health workforce going, is through that campaign, through the Behavioral Health Coalition and the leadership of Mental Health Association of Maryland. So that's what we see with workforce. On crisis services, our big initiative is working with the Fund Maryland 988 campaign, which is a coalition of partners that we helped to convene last year in the run-up to the 2022 session. It has its own standalone website. You can see it there, fundmd988.org, and we try to produce custom social media content and print content and support for our partners in advocating for increased investment in 988, which is the new suicide and crisis lifeline that went live nationwide in July. But each state is responsible for more, for participating in the funding and investment and coordination of that service. Next slide, please. We succeeded. We achieved a lot last year. The first year that the Fund Maryland 988 campaign was active, we secured $5 million for 988 call centers, the 8 that are here in the state. That was in this year's budget. And we also passed legislation that established 988 as Maryland's behavioral health helpline, set up a 988 trust fund that can be used for funding 988 in the long term, and deposited some money in that trust fund. Next slide. Looking ahead for 2023, our goal is to increase the allocation that's in that trust fund to 12 million from 5.5 that was secured last year, and include another allocation of funds in FY25. So that's our legislative goals. But we're also working to educate new lawmakers, connect with the administration, the new gubernatorial administration, the Moore Miller administration, and to just build the capacity of the campaign. We have a new fact sheet that's on the website I mentioned before, the fundmd988.org website. We have developed some tools to help folks to submit ideas to the administration in terms of what policy priorities they should consider. And the template we developed focuses on 988 and crisis services. And we're actively looking for new partners, looking for new ways to kind of document and define the need and how funds have been used so far. And so we are definitely interested in connecting with any of you if you're interested in getting more involved in advocating for a robust 988 network and crisis system here in Maryland. Next slide, please. So the way to do that, if you're interested in joining the campaign, you can email this email here on the screen, md988@bhsbaltimore.org, and we're happy to get you on a list and invite you to our strategy sessions. Those sessions are once a month, and we welcome anybody who's willing to endorse the campaign goals to join us in strategizing on how to move this forward. And in any event, 988 is still really new. Maybe some of y'all haven't even heard of it yet, but it's been around for 6 months. And so we definitely are want to encourage everyone to help educate your network, whatever that may be, about the fact that 988 is here. 988 is the new nationwide 3-digit number for suicide and mental health and substance use crises. And that it's available 24/7, it's free, and we have a robust network here in Maryland to support people in need. So we welcome anybody's help and interest in that. And I think with that, I'm going to pass it on to Chris to move us into our budget-focused part of the program.
Thanks, Dan. And Chris, I will stop sharing and hand it over to you. Did we lose?
Apologize, everyone. I was trying to get the screen sharing, and as always, it did not work.
Yeah.
So you folks should have my slides, and so I might ask for advancement. But anyway, my name is Chris Meyer. I'm a research analyst at the Maryland Center on Economic Policy. For anyone who isn't familiar with our work, we are a nonpartisan, nonprofit think tank that believes every Marylander should be able to achieve their full potential in a healthy economy that offers a widely shared, rising standard of living. We belong to several nationwide networks of similar organizations, the State Priorities Partnership, led by the Center on Budget and Policy Priorities, the Economic Analysis and Research Network, led by the Economic Policy Institute, and Kids Count, led by the Annie E. Casey Foundation. Our staff are part of the Nonprofit Professional Employees Union. Next slide, please. And next slide. So just a quick primer on the work that we do. We've been involved in the Time to Care campaign for paid family and medical leave, the campaign for earned sick days, the campaign for the Blueprint for Maryland's Future, and Fight for 15. Next slide, please. So one of our main guiding principles is that budgets are moral documents. The choices we make about how to use our shared resources affect whether kids are able to get a good education, whether families are able to keep a roof over their head and put food on the table, whether people are able to get the healthcare they need, whether people have access to opportunity or are locked out of opportunity, and whether people are locked behind bars. Next slide, please. So this is going to be a quick whirlwind rundown of Maryland's budget basics. Then afterward, we'll get a little bit more into advocacy. I'm hoping, I recognize there's a range of expertise in the room, so I'm going to try not to go over anyone's head without also, boring anyone who already knows everything I'm saying. Next slide, please. So at the highest level, Maryland's budget can be broken into two pieces. First, there's the operating budget. That's our budget for doing things, and that is funded with current revenue. Animation, please. The other piece is the capital budget. That's our budget for building things. It's funded with debt. The operating budget is going to be most important to the folks in this room. Down arrow twice, please. Thanks. Oh. Yeah, next slide, please. Thanks. So just a quick introduction to the operating budget. Right now we're looking at the 2021 fiscal year, so that began in July 2020, ended in June 2021, just because that's the most recent year for which we have complete actual data. So this is the operating budget. In fiscal year 2021, it totaled $54 billion. About a third of that was health, and the single biggest component of health spending, as well as the biggest single piece of the state budget overall, is Medicaid. Roughly another third of the budget is education, with a little more than half of that being K through 12, and a little bit less than half being higher education. The remaining third of the budget is everything else. Transportation, human services, public safety, which primarily refers to incarceration, housing, and everything else. Next slide, please. Quick introduction to the capital budget, which is going to be less relevant to everyone in this room. The capital budget for fiscal year 2021 was $1.2 billion. A little bit more than half of that is education. Again, slightly more than half of that half is K through 12. A little bit less than half of that is higher education. Then another 15% or so of the capital budget goes toward housing and public safety, and then the remainder is split among a number of other priorities. Animation, please. So There's some overlap between the capital and operating budgets. Again, not super relevant for people in this group, but there's about $700 million in pay-as-you-go money, which is essentially money in the operating budget for capital projects. And then the entire transportation capital budget is part of the operating budget. So that's just sort of the conceptual breakdown. Next slide, please. So next main item to know about the budget is where the money comes from. So about a third of Maryland's budget consists of federal funds. That's the single biggest revenue source, and within federal funds, the single biggest component is Medicaid. The next roughly third of our revenue comes from our two main tax pieces, the individual income tax and the sales tax. Everything else is the remaining third: corporate income tax, fuel taxes and other transportation taxes, lottery and gaming taxes, lottery and gaming revenues, and then higher education revenues, which is mostly tuition. Next slide, please. Then the other way to look at the budget is by fund. This is mostly useful for reading budget documents and knowing what they're talking about. So we can kind of break the budget down into two major chunks. There's state funds, which consists of the general fund and special funds. The general fund can be thought of as the state's main checking account. Then special funds often have dedicated revenue sources. Then federal funds, again, is identical to federal funds in the previous slide. And then higher education funds consists mostly of tuition. In a lot of discussion of the budget, the main focus will be on the general fund, because that's where the bulk of the state operations and things that state policymakers have the most control over happens. But just keep in mind, that's only about a third of the total budget. Next slide, please. So this is kind of a high-level schematic of the budget process. We're going to get into this in more detail in a couple minutes. But at the highest level, we can break down the budget process into three pieces. Summer and fall, which is when the executive branch develops the budget in the first place. The legislative session, where the legislature considers the governor's budget and makes decisions. And then afterward, implementation of the budget in the next fiscal year. And you'll notice on the right side, it says summer to fall. Obviously, implementation continues throughout the year, but that's just to emphasize that as soon as this year's budget starts being implemented, next year's budget starts being developed. So looking at summer and fall, the biggest piece of that is executive budget development. So within the executive branch, there's an interplay between state agencies and the Department of Budget and Management and the governor to determine what the governor's budget proposal is going to be. During that time, there are two major events to watch. The September revenue estimates produced by the Board of Revenue Estimates and the December revenue estimates. You'll see the December bubble is a little darker there because those revenue estimates are used to determine whether the budget is balanced when the governor introduces it. At the same time, the Spending Affordability Committee is a legislative committee consisting of members of both the House of Delegates and the Senate that first receives a briefing on the overall economic state of the state and then makes recommendations for the overall level of spending and other things. Those recommendations are non-binding, but in practice, they're almost always followed. Also happening in the fall is the beginning of the federal fiscal year. Moving on to the legislative session, the first thing that happens is the governor introduces the budget. Then soon thereafter, the Department of Legislative Services provides a fiscal briefing, which is a high-level presentation to legislators on the contours of the governor's budget. Because just like people in this room, many of whom are experts, the legislators can't necessarily, read through the entire budget on their own and know what's happening. Then in March, the Bureau of Revenue Estimates updates its estimates, and those are the estimates that are needed to.
James, to make sure he got towels and.
If you're not muted, everybody, please do mute yourself. But March is when we determine whether the adopted budget is balanced. Then there are some changes that we'll get into more in a minute. Next slide, please. So now we're going to talk a little bit about Maryland's new budget process, which is the result of a constitutional amendment that voters passed in 2020. Next slide, please. So let's first talk about the old budget system. This was in place since 1916, so a little bit over 100 years. And Maryland was essentially unique in the entire country in this system. We had the most powerful governor in the country with respect to the budget, and as a corollary, the least powerful legislature. The legislature under this system could only cut items from the budget, and this is specifically talking about the operating budget. They couldn't increase funding, they couldn't even move funding. And this created sort of an annual budget tug of war. There are some limited ways that the legislature could influence the budget, such as creating mandates for future years or restricting funds to only be used for certain services. But this essentially created an annual conflict and often resulted in money being left on the table. So this year, we're finally beginning to implement this new constitutional amendment. And this essentially puts us in line with all the other states in having a more balanced process between the governor and the legislature. In this process, MGA stands for the Maryland General Assembly. The legislature can move funding between programs. They still cannot increase the total budget. As sort of the compromise in this process, the governor will gain a line item veto, which basically means that any changes made by the legislature, the governor can veto. And just like any other veto, a supermajority of the legislature can override it. Next slide, please. Oh yes, again, that's everything that's changing is only the operating budget. The capital budget is not affected at all. So this creates new opportunities for advocates. So in the old budget system, budget development in the executive branch was where all the action was pretty much, and it was completely untransparent, just all behind closed doors. There were limited advocacy opportunities with executive agencies if you happen to have relationships in those agencies. Likewise, if you had a relationship with the governor, you can do limited advocacy there. But the major advocacy opportunities would be during the legislative session, but those are pretty limited. So each agency has a budget hearing in front of each chamber's budget committee. Those include public testimony, but there's very little the legislature actually could do. They could reject so-called contingent reductions, which is where a certain level of funding is mandated by law and the governor wants to cut it further, the legislature can say no. They could fence off money, which is essentially restricting money for only certain purposes. They could create future mandates, or they could cut more. That's all changing beginning in this session. So the situation in the executive branch is staying pretty much the same. Behind closed doors, if you have relationships, you might be able to do a little bit of advocacy. But there are going to be significant new opportunities to advocate with legislators. Not in the structure of advocacy. Again, that will still mostly be in agencies' budget hearings. But those are going to be a lot more meaningful now because legislators will actually be able to move funding from one program to another, not just cut. The downside is any moving of funding has to come with a corresponding cut to something else. You can't increase total funding in the coming year's budget with new revenue. That's going to create a temptation for advocates to fight for crumbs. we encourage you to resist that. Next slide, please. So again, if we look at that high level schematic of the budget process, pretty much everything that's happening is in that middle section of the legislative session. Next slide, please. So here we're kind of zooming in on the summer and fall period, which is executive budget development. I've got a whole color coding system. I hope that's not too confusing. Hope it's helpful. Executive budget development entirely happens behind closed doors. There are some important events to watch, namely the September and December revenue estimates and the Spending Affordability Committee. Those meetings happen in public, and they also have summary documents that are available to the public. Again, nothing in this section of budget development changes. Animation, please. There are no good advocacy opportunities during this period, but animation, please, there are some limited advocacy opportunities if you have relationships. Next slide, please. So here we're zooming in on the legislative session. This is where most of the action takes place. So the first thing that happens is the governor introduces the budget near the beginning of the session. The entire budget process is going to be compressed this year. Animation, please, because we have a new governor. And so the new governor is given a little bit more time to introduce the budget. Then again is the fiscal briefing, where DLS helps explain everything to legislators and the public. The biggest piece, animation, please, is the agency budget hearings. So representatives from each state agency get in front of the House Appropriations Committee and the State Budget and Tax Committee and explain the agency's budget, respond to items highlighted by the Department of Legislative Services. They answer any questions from the committee, and the public has a chance to give testimony. Structurally, these aren't changing, but again, they're becoming a great deal more meaningful because now you can actually ask legislators to increase funding for your priorities, and they have the ability to do so. Animation, please. So next, each legislative chamber, the Senate and the House, make their decisions, and then the budget will almost always go to conference committee, which is a committee that makes compromises between the two chambers' budgets. The process there, the decisions happen behind closed doors pretty much, but documents are released to the general public so you can follow along what's happening. Next up, the legislature approves the budget, and then is the next big change, animation please, which is that the governor is able to make line item vetoes. Again, that means if the legislature increases or decreases funding compared to the governor's budget, the governor can reverse those changes. And then again, there's an opportunity for a veto override. You might notice that those two boxes extend a little bit beyond the end of the legislative session. That's because the constitutional amendment doesn't actually specify the timing of when these vetoes and overrides happen. So that means it just goes according to the normal process. And in the normal process, bills that are passed late in session, the governor can override after the session is over, which means that if this happened for the budget, the General Assembly would have to convene a special session to do overrides. Animation, and then next slide, please. So I'm starting to run out of time, so I'm going to be brief on these areas, but we have some recommendations that we're making to policymakers on how to change the budget process to make it more transparent and more inclusive. First of those is to increase the emphasis on the baseline budget in budget documents. That basically is the budget for how much it would cost to continue current services and practices into the next year. That's more informative than just looking at the dollar increase or decrease, since background factors like population change, inflation, and so on will change the amount of money needed to just continue current policies. So that would help actually show legislators and the public what policy changes the governor has in mind. Next slide, please. Next slide. Next slide. Thanks. So our biggest recommendation for advocates is not to fight for crumbs. The budget process that we're starting this year is going to make it tempting since every increase has to come with a decrease. Animation, please. We are already underinvesting in so many areas of Maryland communities that we really need to increase the overall size of the pie. The biggest component of that is to strengthen state revenues. Next slide, please. So I'm not going to go over this, but you will have access to the slides afterward. This is both the rationale and how we can improve the state's revenue system. Next slide. So these are some quick guidelines for how to talk about budgets. Not going to go over it. Next slide. And these are some helpful websites. What we're seeing here is government websites that help you see what's in the budget and help you understand it. 2 animations, please. We also recommend keeping an eye on our website, the Maryland Center on Economic Policy, for our perspective on the budget. And then the Maryland Fair Funding Coalition is a coalition that's working on getting fair tax reform through. And with that, I'll move on to questions.
Thank you so much, Chris. That was a really good overview. Sorry you had to rush, but we will send those slides out afterwards because I think there's a lot of really helpful information in the slides that Chris did not get a chance to go over. So if you have any questions that you're thinking of now related to the budgeting process, please drop them in the chat because we have one more presenter and then we're gonna move to question and answer. So if anything occurred to you while you were watching Chris's presentation, drop that in the chat now. We are monitoring that and we'll do the questions and answer at the end. So at this point, we're gonna move to our final presenter today, and that is Samantha Tapia, who is with us from the Department of Legislative Services. And she will be presenting on something that I know this audience is all very close to, which is behavioral health services as it relates to the FY24 budget. So I'm going to turn it over to you, Samantha. Are your slides showing?
Yes, I see them. Can you all hear me okay?
Yes.
I can hear you, yes.
Okay, great, thank you. So again, my name is Samantha Tapia. I'm new to the Department of Legislative Services and assigned to the Behavioral Health Administration. Again, we are budget focused, and also present are my manager, Tanya Zimmerman, and Senior Health Analyst Ann Wagner for questions, historical and more technical questions, and having the Medicaid assignment. Okay, next slide. So we publish operating budget analyses for each agency during session. So some of this information is in the last analysis, looking forward to fiscal 2023. But these analyses only reflect the governor's allowance, whereas I am including the appropriation, which is after supplemental budgets, and then I will also include a list of the budget amendments that have happened during the fiscal year 2023. But it's noted in the last analysis that BHA is relatively level funded. That doesn't appear to be the case in this graph, but that is due to deficiency appropriations that happened in the middle of fiscal 2022. So, which were primarily from 2021 provider payments for 2021 provider services, and that was about 340 million. This is in addition to about 70 million for rate increases, and then 13 million for issues related to the ASO. So around total of around 420 million. So if you kind of imagine that taken off of the 2022 actual and tacked onto the 2021, you can kind of see that is the case, that BHA is relatively level funded, and that's expected to sort of continue apart from adaptation to inflation. So the governor's allowance was around 2.6 billion, and the appropriation ultimately around 2.7 million. Supplemental budget funds added around 117 billion to the total. And again, you can see kind of thank you to Chris for outlining for the general federal and special funds, which you can see down here broken down. Next slide. So budget amendments, you can see here, most importantly, we had a 4% rate increase. And this is in addition to the mandated 3.25% increase that was laid out in a schedule of rate increases determined in 2018. And this was through statutes statutes in 2018 for 2019 through 2026. So 2023, 3.25%, and scheduled for 2024 is going to be 3%. But in fiscal 2023, we have a total of 7.25% from the 4% and 3.25%. More specifics on how the rate increases apply can be found in that statute language, section 16.201.3 of the Health General article. Next, most important that I have notes on are the 988 line that Dan talked about. He mentioned the current funding. This is through the 2022 bill SB 241 or HB 293. 5 million for fiscal 2023, which includes 410,000 specifically noted for public messaging. And then fiscal 2024 laid out 5.5 million for the 988 line development. Other than those two specific items, we have salary and cost of living adjustments that include regular yearly salary increases as well as cost of living adjustments for inflation. The other items I may be including updates on in the analysis that will be published. And then if you have specific questions, you could, during Q&A, you might try, Tanya and Anne might also have some historical details on these issues. Next slide. Areas of uncertainty and focus. Looking forward to fiscal 2024. The most important is the timing of the end of the public health emergency declaration. So this was last renewed in October and intended to last through January. For a number of reasons, it's expected to last through April. Two most important issues with regard to budgeting have been the increased amount of federal funds through the enhanced FMAP. And then the other most important thing is the disenrollment. That disenrollment has been solved under the continuous enrollment requirement, which many of you probably know. A problem has been an expectation of a wave of disenrollment with the end of the public health emergency declaration. The exact amount of that disenrollment is not known yet, but there are some estimates. Enrollment having increased from fiscal 20 to 2022, around 18%, and as of December, Medicaid plus CHIP was around 1.7 million, or 1 in 4 Marylanders, which is quite a lot. There are some forecasts for the percent decrease, but as the health emergency declaration has still been in place and ongoing, that those estimates are going to be maybe changing. The omnibus bill that was recently passed at the end of December tackled both of these issues. So for the disenrollment issue, it disentangled the issue of disenrollment from the public health emergency declaration, allowing states to begin disenrollment on April 1st, regardless of whether the emergency order is still in place. And it also established a phase out plan of the enhanced federal match to help states prepare for to prepare for the elimination of the enhanced federal match to prevent as much of a budget shock to states. And then in terms of pandemic recovery, we have factored in an expectation of in-person and residential services to increase with awareness of a potential new normal in utilization of behavioral health services. And this was noted in the last analysis and has also appeared as an issue in a number of national news articles in the first half of fiscal 2023. Then with regards to the opioid epidemic, CDC data shows that shows a decrease in opioid-related deaths in fiscal 2022, suggesting a return to pre-pandemic levels, although those were still high. This is noted in the opioid task force meeting that took place in October. And then moving on to the ASO issue, which again, many of you probably know about, but I'm not sure. The most recent information that we have on this is from the September JCR report submission and the audit report that was published in October, along with the audit hearing that also took place in October. And at that time in September, it was estimated about 146 million due across 712 providers. And there was a survey of repayment options still ongoing in October. And again, this is an update on this should appear in any analysis that will be published relatively soon. The audit report also notes that the BHA plans to continue recruitment efforts through December 2023, after which unsettled accounts will be sent to collections. And then in terms of the contract replacement, which was discussed most importantly in the audit hearing, the current contract with Optum was intended to last from January 1st, 2020 through December 31st, 2024. And the audit notes that BHA intends to bring a new contract before the Board of Public Works within the first half of this calendar year, 2023. So that's something to look out for. And then an increased level of oversight planned for evaluating the contracts and performance of a new contractor. So those are all the notes that I have right now. Again, as Chris kind of laid out, the actual budget data is going to be published on the 20th. And again, we have analyses for each agency that will be published during session that will review a lot of the items that are currently still need to be updated. And I can take questions, or again, my manager Tanya Zimmerman and Ann Wagner are here also to answer questions. Tanya having constructed the baseline and probably able to answer some of the more technical questions, also potentially related to the changes in DLS's handling of the new capacities in the legislature to add funds.
Great, thank you, Samantha. So I have seen, so actually now's the time for questions. We've got around 10 minutes for question and answers. I did see some question and answers happening in the chat. I saw a couple around the ASO, and hopefully Samantha just answered some of your questions. But for those who have not been monitoring the chat, I'll just kind of quickly summarize. There were some questions around what's going to happen legislatively with the ASO. And then if there's, what's going to happen with repayment. So hopefully Samantha covered that. I'll weigh in on the first question around what's going to happen legislatively. And I think the answer is we have a lot of opportunity there. There's going to be a change. There's a change in leadership legislatively across the board. There's a change, in the governor's office. There's change coming to leadership at the Maryland Department of Health, all of which provides opportunities for us as providers and advocates to express concerns, challenges, and all of that has been happening over the past several years. But one of the things that we do know that Samantha noted is that the ASO vendor will be changing. The Maryland Department of Health has been very public in letting everybody know that they are planning to release an RFP to identify a new ASO over the course of the next year. And the goal is to release that RFP as soon as possible. So here's an advocacy opportunity. It's not yet been released, but encouraging the department to release it as soon as possible is important, because I saw we have another question about how should providers transition. We need to ensure there's an adequate amount of time to transition from one ASO to another. That is a big system change. So encouraging the department to release that RFP in a timely manner and then ensure that there's enough time built in to support and manage that transition are key messages that should be shared with leadership. And then, so I'm going to jump to another area of questions and ping you, Stacy. I saw there were some questions around children and youth in the 1915I. Can you summarize that real quick?
Yeah, I also responded to it in the chat. So basically, that is a concern, particularly around a lot of the issues with youth and increased ER stays. And so that is something that's on the radar of the Children's Behavioral Health Coalition. There's actually a priority with the Maryland Children's Behavioral Health Coalition that is looking to address and to really reinstate home and community-based services. And so for children and youth, and so that is a priority. That is an issue that should be coming up. And I know specifically the person that asked about the coalition and the coalition work, I will work to connect you as well to that. But that is something that we expect to be a conversation during the session and hope to move forward in expanding those services.
Thank you, Stacy. And then I saw a question around provider repayments from Melissa. That is not something we can specifically address on today's call, but I've got two answers that may provide you some support. One, the Maryland Community Behavioral Health Association has really been, if you're not familiar with them, they're a membership organization. They represent providers across the state, and they have really been leading up the advocacy work with the Department of Health around this. So if you're not plugged in with them, I would encourage you to plug in with them, and I'll drop their information in the chat. They have certainly been leading up the advocacy with the legislature and the Department of Health, but I know they've also taken some legal action, and there's opportunity there, and those are details I don't quite know. And then certainly following up with the Department of Health. So that's the best support I can provide to answer that question on this call. But if you want to follow up with me afterwards, I can connect you more directly to the Maryland Community Behavioral Health Association. And then I saw a question around slides. Yes, we will make all of these slides and send them out available and make them available after the meeting. We have a question from Michelle in the chat. This might be for Chris or Samantha. Can you provide further clarification on the intended continuation of level funding in the budget for behavioral health? Actually, that's probably for you, Samantha, or your colleagues.
I'll take this question. This is Tanya Zimmerman with the Department of Legislative Services. So we don't have information on what will be in the upcoming budget. That information will be available on February 20th, which is the day that the governor is required to submit the operating budget. As was mentioned in the earlier presentation, in the first year of a term, the governor has 2 additional days to submit the budget, where we would normally expect it to be required to be submitted on Wednesday. It'll be submitted on that Friday. Kind of the first main look, as was discussed, will be in that fiscal briefing, which will be held the following week after the budget is submitted. But once the budget is submitted on that Friday, there will be start to begin to be information available on what the actual level of funding in the budget will look like.
Thank you, Tanya. Are there any other questions? We have a question about from Barry. Will the report released on the 20th provide detailed line item numbers? I think Barry, I think Barry's referring to the budget.
So the budget bill itself provides information at a program level, and then by fund source within each program. It doesn't have, Maryland does not budget at a, Maryland's budget bill is not provided at a line item level. But there is more description and information about what is included in each budget, and the analyses that Samantha mentioned are published for each kind of agency, and for the larger agencies like the Department of Health. There's multiple analyses, and then also for the Maryland Department of Health, along with some of the other larger agencies, there is an overview document that is generally heard relatively early in session, and so that provides kind of an overall look at the department's funding, and would be likely available sooner than some of the kind of individual assignments, but the budget bill itself is at a program level.
Thank you, Tanya. And so what Tanya was referring to, and Chris, feel free to chime in if you want. Chris was talking about how important those agency budget hearings are during the legislative session. What Tanya was referring to are the analyses that come out in advance of those agency budget hearings. They provide a lot more information. I don't know, Chris, if you want to add anything to that, or.
Nope, I think that just about covers it. Maybe I'll just add that DLS really is the best friend for advocates and anyone following the budget.
Thank you. And I saw we had a question about getting involved with the 988 campaign, and Dan just dropped that information into the chat. Feel free to follow up with him directly. I see we've got a hand raised. If you could type your question into the chat, that's how we're keeping track of the discussion. We probably have time for this one more question. Oh, it's Pat. Hey, Pat.
Hey,
go ahead,
Adrian.
ask your question.
Okay. First of all, I'd like to say thank you for this presentation. It was just terrific information. I think it was a great overview, and I learned new things. But getting back to the ASO, just and you may not have this information, but I just want to ask, or bring it to the table a little bit about once that ASO, once the RFP is completed, in that process for the new RFP, are we putting any focus on quality or anything around reimbursement for people with co-occurring disorders? I think the quality component is important. One of the things that we know, and you've heard me say this so many times, but we know from a national data perspective that, and especially amongst youth and children and adolescents, that those with co-occurring disorders are about 70% of the population, which, with someone with substance use also has a mental illness, and someone with a mental illness also has a substance use disorder. But one of the things that I've encountered in my time with working with providers who I think, are doing a great job. But, sometimes there's frustration in that when they're reimbursed, they only get, right now, our system is some, it's not just Maryland, it's the federal government as well that, has to help us with this. But we can certainly move along and do something creative, I think, in the meantime. But when you will say to a provider, well, when you call for your authorization, did this person, are you giving them information that this person has a co-occurring disorder, has both disorders? And sometimes I get answers like, well, why should I? Because I'm only going to get reimbursed
Hey,
for.
Pat.
Uh-huh.
I'm sorry to cut you off and interrupt. We are at time, and I know I need to let our presenters go because they've got other things today, but I do want to very quickly respond to the RFP. We have not seen it yet, but I have heard that there are components in there to address the quality issue. The co-occurring, I think, is a continued advocacy opportunity with Medicaid. And like we were saying earlier, more leadership changes there, and we'd love to work with you on that.
Yeah, thank you.
I'm sorry to cut you off. With that, I want to just thank everybody for coming today. I see for our presenters, thank you so much. I see a lot of kudos and thanks in the chat for you for the information that you provided. We will send the slides out and this recording afterwards for those of you who have registered. And just thank you again for coming and joining us today.
Thanks, everybody. Have a great week.